First of all, I would like to thank Pat and Dr. Anne Lee for inviting me to attend this very important symposium. Following Larry's presentation on the global perspective, I will bring you all back to Hong Kong and share with you what is the strategy on cancer prevention and control is like in Hong Kong. My talk shall very briefly touch the global burden of NCDs, the cancer epidemiology in Hong Kong, the 5 major behavioral risk factors, the policy framework, the coordinating mechanism, our local surveillance system, as well as primary prevention and secondary prevention of cancer. Looking at the global burden of non-communicable diseases, or what we call NCDs. Globally, according to the World Health Organization, the statistics is not the latest, but at least back in 2008, 57 million deaths in Hong Kong worldwide. Cancer alone accounts for 21%. And about 30% of cancer causes deaths are caused by 5 leading behavioral and dietary risk factors, namely high body mass index, low fruit and vegetable intake, lack of physical activity, tobacco use, and alcohol use. So approximately 70% of cancer deaths in 2008 occurred in the low and middle income countries. And deaths from cancer worldwide are projected to continue to rise, and with an estimated 13 million deaths in 2030. Globally, the World Health Organization had endorsed an action plan on the Global Non-Communicable Diseases Action Plan for 2013 up to 2020 in the World Health Assembly held in Geneva last year. And it has set 9 voluntary global NCD targets for 2025, one of which is concerned with NCDs. And there's a target of 25% reduction of premature mortality from 4 NCDs covering cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes. As for cancer epidemiology in Hong Kong, well, before the tea break, Dr. Roger An has shared with you the latest findings according to the Cancer Registry of Hong Kong. So I will not repeat the details, but suffice to say, you will note from the pie chart that cancer is the leading cause of death in Hong Kong and accounts for about 30.5% of the total. Cancer is also the leading burden in terms of morbidity. And in terms of inpatient discharges and death, it's topped again in the chart, and it accounts for 9.2% of all inpatient discharges and deaths, based on the statistics collected from the Department of Health and from the Census and Statistics Department of Hong Kong. So I will now go into the behavioral and dietary risk factors, which are considered to be the 5 leading risks for NCDs, many of which are actually preventable, and the control is in yours and my own hand. The first one is about high body mass index. The second is low fruit and vegetables intake. Third is lack of physical activity. Fourth is the well-known tobacco use. I put a star next to the fifth one, it's about alcohol use. Because when I talk to a lot of my colleagues in the medical profession, and I tell them alcohol is in fact a group 1 carcinogen. That is the same class of carcinogen as tobacco. Quite a number of health professional colleagues simply stare at me. They seem not to be fully aware of this. And this is not only in Hong Kong. In my recent encounter with other health professionals from other countries in a WHO alcohol workshop, actually this phenomenon seems to be quite similar in different parts of the world. So alcohol, for all you know, alcoholic beverages is carcinogenic to humans. Group 1 means there is very clear scientific evidence that it causes cancer in humans. Obesity. High BMI, body mass index, which is defined by the formula, it's your body weight in kilogram divided by the square of your height in meter. It's often quoted as one of the indicators to monitor overweight and obesity. If your body mass index is equal or greater than 25, it is classified as obese. But the use of BMI has some limitations in our Asian population. So more recently, in particular for the Asian population, the concept of central obesity has been introduced. And it has two magic figures. For women, it's 80 centimeters, and for men, it's 95 centimeters. For some of you who may not have gone completely metric, let me tell you, 80 cm is 31.5 inches, and 90 cm is 35.4 inches. So ladies and gentlemen, watch out for your waist. So you can look at this is one of the trends of the obesity collected from our behavioral risk factor survey since 2004. Actually, we are happy to note that in our child population, there's a slight downward trend in the incidence of obesity. So we have been doing a lot of work that I shall share with you later, but we must keep on this because our diet definitely influence our health. The second risk factor is low fruit and vegetable intake. Well, you can see one green line and one red line, which appears high, but this is no good news. This is actually bad news. If you can see the small words, the green line actually reflects to low daily fruit and vegetable intake. And according to our survey, it's more than 80% of our population have low daily fruit and vegetable intake. By that I mean at least 5 portions of fruit or vegetables per day. And let's look at about our survey on physical activity. And again, it's far from satisfactory. It's people who lack physical activity, it's actually about 60+%. And by that physical activity, again, the literature actually advocates at least 150 minutes of moderately intense aerobic physical exercise throughout the week, or at least 75 minutes of vigorous intensive physical activity throughout the week. So again, this is something that an individual can do more to protect your own health. Tobacco use. We are pleased to note that actually the tobacco use in Hong Kong has been on the decrease. And the latest figure, according to the Census and Statistics Department Thematic Household Survey, the latest incidence of smoking prevalence in Hong Kong is 10.7%, which is amongst the lowest in the world. For alcohol, this is perhaps not as encouraging. This chart shows the drinking prevalence among Hong Kong students by age, and you will note that there is an increasing number of young people who start to drink. And if you look at binge drinking, and by that I mean drinking at least 5 glasses or cans of alcohol on any one occasion during the 30 days prior to the survey, you will note that the age group which engaged most in binge drinking, it's actually very high in the 18 to 24 years age group, and not so much in the more mature adult population. So next, talk about the policy framework in Hong Kong. In the Chief Executive Policy Address for 2007-2008, there's an initiative to introduce an NCD prevention strategy for NCDs. So against that policy directive, the government set up the steering committee and developed a strategic framework for prevention and control of non-communicable diseases in Hong Kong. And this document was launched in 2008. The goal is to increase positive health and quality of life of people in Hong Kong, and the focus is on the major risk factors that are potentially modifiable and have significant impact on health. The Steering Committee on Prevention and Control of NCDs was established in the same year to deliberate and oversee the overall roadmap of the framework. So, intervention is best if we start at upstream. So we are looking at the behavioral risk factor, namely smoking, unhealthy diet, inadequate physical activity, alcohol use, etc. Because this can, in consequence, affect a lot of biomedical risk factors such as obesity, high blood pressure, diabetes, and blood lipid. And this in turn will result in heart diseases, stroke, diabetes, cancer, and many other chronic diseases. So by having a healthier diet, increasing physical activity, and stopping smoking, it is actually estimated that at least 80% of coronary heart diseases, about 80% of type 2 diabetes, as well as about 40% of cancer can be prevented. So the strategic framework for prevention and control of NCD in Hong Kong actually has set 6 strategic directions covering health promotion, information-based partnership, capacity building, a responsive healthcare sector, and health promoting legislation. And we also identify key elements for success. We use the acronym PEOPLE, meaning partnership, environment, outcome-focused, population-based intervention, adopting a life force approach, and empowerment. Just now, member from the audience raised a question to Professor Dai about air pollution and health impact. So actually, for a health problem, it needs the cooperation from many sectors, and that is why the health sector cannot work alone. And we need to work with people from other disciplines and other sectors before we can actually do something about the prevention and control of NCDs. So the Secretary for Food and Health formed and chaired a steering committee on prevention and control of NCDs. And under this steering committee, there are 4 working groups covering diet and physical activity, alcohol and health injuries, and another group looking at other priority areas. As for the coordinating mechanism, the coordinating committee for cancer was set up in 2001. And again, in order to demonstrate political commitment, it is chaired by the Secretary for Food and Health himself. And the task is to review local and international scientific evidence and to formulate strategies and make recommendations for cancer prevention and control. Under this committee, there are 4 cancer expert working groups, which have been set up to look into cancer data and priorities, cancer prevention and screening, cancer treatment services standards, as well as cancer research and development. I'll talk a little bit about the recommendations on prevention and screening. The expert working group have produced a report on cancer prevention and screening back in 2004 and made local recommendations for the prevention and screening of 7 cancers. And the working group have reviewed and updated the recommendation on the prevention and screening of 3 cancers, namely prostate, colorectal cancer, and prostate cancer. And this year, the group have also produced a bilingual cancer booklet for the general public to promote public awareness and early detection. In the later part of today's seminar, I understand Professor Teach Len will be speaking in more details. So I shall not further go into the details at this point. Surveillance. Surveillance is a very important part in the whole cancer prevention and control strategy. When I mention the word surveillance, many of you may perhaps think of collecting data of cancer diseases, how many cancer inpatient statistics we have, like what the cancer registry is doing. But actually in public health, the surveillance system not only capture data and do analysis on the disease number itself, we are actually looking at risk factors that lead to these diseases. So we have surveillance system on behavioral risk factors, we have population health survey, and we also have the medical health survey in addition to the Hong Kong Cancer Registry. The behavioral risk factors surveillance was started in 2004, and information was collected through telephone surveys annually and sampled around at least 2,000 land-based non-institutionalized person between the age group of 18 to 40. It is important to track this population so that we know whether there's any changes or patterns of concern in terms of these risk factors. The population health survey was a much more large-scale study, and the first study was done in 2003 and 4. We are now in the planning stage of the second public health survey, and hopefully it can start in 2014. As for the thematic household survey, this is performed by the Government Census and Statistics Department, and there are some specific health-related themes which are done on a regular basis. In Cancer Registry, Dr. Khan has already just shared with you the latest findings. So I shall now go on to discuss primary prevention of cancer. I have told you about the risk factors. So one of the important areas is to address promoting healthy diet and physical exercise. Just to illustrate some of the actions that have been implemented, it includes, for example, Start Smart at School campaign, which aims at preschool children, and the Eat Smart at School campaign, which promotes healthy eating at primary school, and also the Eat Smart at Restaurant campaign, which targets at the catering industry and the dietetic profession. This is important because if you just tell people what to do, they may have the knowledge, but the environment is not conducive to engaging healthy behavior. People simply would not follow advice. So that's why we have been working with the school sectors, with the education sectors, with parents, with teachers, with the caterers, with the restaurant owners, to push out a whole scale of activities which aim to enlist the support of this organization to engage really in healthy eating. For example, the Eat Smart restaurant, they will be eligible to quote our logo if the restaurant serve at least 5 more fruit and vegetables dishes, or some 3 less, what we call sometimes low in cholesterol, low in fat, and low in sugar dishes on a regular basis per day. We also have to do something about the choice of food for consumers. So that's why the government introduced a new piece of law introducing the mandatory requirements for nutrition labeling in 2010. As for physical exercise, again, we target at the young population, and in the workplace setting, we also collaborate with some NGOs to promote doing more physical activity. Some of the close partners for these campaigns include the Leisure and Cultural Services Department of Hong Kong, and we also work with the Hospital Authority and, for example, the Ideal BMI Disease Prevention Project. The above are simply some examples to illustrate how in the prevention and control of cancer, or indeed any NCD, the health sector cannot work alone. We have to work very closely with other sectors. So back to alcohol. Alcohol is a blood-borne carcinogen. Many of you may be aware that alcohol is related to cancer of the oral cavity, the thorax, the larynx, the esophagus, and the liver. And perhaps not that many of you are aware, alcohol is also associated with the cause of breast cancer in female and colorectal cancer. And you just heard from Dr. Roger Ahn that these two are the cancer which warrants our attention because the number is only complete. So in order to reduce alcohol-related harm in Hong Kong, again, the Working Group on Alcohol and Health have launched a document in October 2011 and come up with recommendations and action areas, including improving our information system to review and strengthen the existing surveillance, to make use of appropriate research means, and to explore options to work with other law enforcement agencies such as the police and the social welfare data to collect information on alcohol-related harm. There's also a need for capacity building because, as I pointed out earlier, even within the health profession, not that many are really aware of the carcinogenic effect of alcohol, being classified as a group 1 carcinogen. So you might have seen a lot on television and movies, glamorous movie star enjoying a glass of good wine and telling you which wine house in France is the best. And you may not have seen this. Actually, the medical profession is already starting to do more health education to reduce alcohol-related harm. And back in about 2 years ago, the Hong Kong Academy of Medicine which is the leading professional body to advocate specialist developments, have come together, and representatives from colleges coming from community medicine, physicians, emergency medicine, psychiatrists, and family physicians have held a press conference and conducted a number of public lectures on the harmful use of alcohol. But that unfortunately seems not to be very widely covered by the media. And our media is probably more interested in promoting wine. And in the regional basis, Hong Kong also worked very closely with the Western Pacific WHO regional office. And for the past few years, we have been supporting the Western Pacific region of WHO to hold conference in Hong Kong and invite members, representatives from the neighboring countries and regions to participate in training workshops. And this is a picture taken in November where the second alcohol-related workshop was conducted in Hong Kong, and I was the chair for that meeting. Tobacco control has a slightly more encouraging picture. Back in 2001, DEH set up our tobacco control office, and our major responsibility is on health education, law enforcement, and coordinate smoking cessation services. Mary's PowerPoint also mentioned one important strategy for the control and prevention of NCDs and taxation. That's very important. So every now and then, near to the time when the government is about to prepare the budget, our tobacco industry friend will conduct some press conference saying that further increasing tobacco tax will increase in tobacco smuggling. And this is the tactics that they have been doing worldwide. So if you look at WHO strategy, empower, that means monitor, protect, offer, warn, enforce, and raise. And raising tobacco tax is one of the most effective instruments to combat tobacco harm. Hong Kong achieved a very low smoking prevalence, the latest figure being 10.7%, which we are indeed very proud of. But this has not come easy. Our work for tobacco control have started 30 years ago, and it's more than 30 years hard work before we come to this stage. But the battle is not ended yet. Worldwide, especially for developing countries who wish to put in more control for tobacco control, have been taken to court by the tobacco giant. So, Dr. Dai, keep up the good work in China. We will help support you and work with you. In fact, Hong Kong is a WHO collaborating center for tobacco cessation program, and we work very closely with our neighboring countries and regions partner in promoting further action against tobacco. I shall just very briefly touch on secondary prevention of cancer. The previous slide was on primary prevention. By that, we aim to prevent the onset of disease. As for secondary prevention, it actually aims to prevent the further decline of a condition by early detection or early screening. The definition of screening is the presumptive identification of unrecognized disease or defect by the application of tests, examinations, or other procedures which can be applied rapidly. And screening tests sort out apparently well persons who probably have a disease from those who probably do not. And the screening test is not intended to be diagnostic. This is the well-known Wilson and Juncker criteria for population screening. If you read enough newspaper in Hong Kong, you will be aware that there has been some different views expressed in terms of screening. And for the past 2 months or so, representatives from the Hong Kong College of Family Physicians have written some very good and detailed articles on population screening. And the author was actually making reference to Wilson and Juncker criteria for population screening, which is taught to all medical students in Hong Kong. And Professor Lam, I believe you are still teaching that. I'm sure he is. So all along in the scientific community, Wilson and Juncker criteria for population screening is what we are taught since medical students day. I will not go into the details because Professor Lam will be having a special session on this, and he will further explain. And I just mentioned one example on population screening, which has been introduced in Hong Kong on a population basis since 2004. That's the cervical cancer screening, and it aims to facilitate and encourage women to have regular cervical smear and to reduce incidence and mortality due to cervical cancer in Hong Kong. In the past year or so, my colleagues have been engaging in active discussion with Dr. Roger An and his team and other colleagues in the field with a view to strengthen collaboration with the cancer registry. And hopefully we hope to get some resources to further enhance the support for the cancer registry. So to conclude, the way forward, cancer prevention and control is a major public health challenge and also a priority area targeted by my department. We shall continue to maintain surveillance, promote healthy lifestyle, strengthen cancer awareness, and support the work and deliberations of the different working groups. I hope, well, you may be hungry by now, but I hope at least you take home some simple message. The prevention of cancer can be simple, and you can take it all in your own hands by simple modification of your behavior. The World Health Organization did not ask you to pay hundreds of dollars to buy health supplements or special antioxidants, whatever. Just take plenty of vegetables and fruit, and that's already very good. Regular exercise, wash your waistline, never smoke, drinking. Do not drink if you have not started. If you are already a one-of try to get less. And certainly, as advocates in cancer prevention and people who are dedicated to the prevention and control of cancer, I wish you to take home a question. When you next toast to good health, should you be toasting with a glass of plasma drink or not? So with that, I end my presentation. I look forward to collaboration with you from different sectors and also internationally in our fight against cancer. Thank you.
Thank you.